take care of that. Essentially, we do an operation what is known as a keyhole surgery or arthroscopic surgery.
Go ahead, run with that.
So essentially, that is for people who have, say, the rest of the knee is healthy and the meniscus is torn. It's a day procedure. You come in, you go home the same day, and we just make small 2 or 3 keyholes in the knee. A hole big enough that you can put a camera as thick as this pencil and an instrument through the holes, and you work through those holes, and the camera essentially takes the picture through a cable and displays it on a television monitor, and you look at the television monitor and you do everything inside the knee. And it takes about half an hour or so, or less than that.
And you used to have to open up the knee.
Exactly. I would say 20, 25 years ago, if you have a small torn cartilage, you have to make a big incision, go inside, and that operation takes an hour to 2 hours. And the bigger incision you make, the more time you have to give yourself to recover from it. And nowadays, with these operations, it takes less than half an hour. Patient comes and he goes home, and within 3 or 4 days, he or she is doing what they normally do. Yeah.
That's fascinating. And the complications are much less.
Much less.
With, I mean, there's not very much blood loss, is there?
No, hardly any blood.
Hardly any,
blood,
right?
Because I said the incisions are very small.
Very small.
Sometimes we tend to do it under what is known as a tourniquet, and the way it works is if you're having any surgery on your limb, you can put like a blood pressure cuff around the thigh or the arm, and you inflate this, just like having a blood pressure taken. And what that does is when the pressure is tight enough that it prevents the blood supply to go to the operating site. And if there's no blood supply, you can do the operation. There's no blood loss. If there's no blood loss, you can see better. And if you can see better, you can do the operation faster and better. And so there's hardly any blood loss whatsoever through these keyhole surgeries.
And and I know the audience is happy to hear that, because oftentimes they wonder what's arthroscopic surgery all about. It's nice for them to hear that it's really pretty low key surgery as far as complications. And they go home the same day.
They go home the same day.
And good.
The complication rate is, I would say, less than 0.5%.
Good.
Yeah.
And as far as prevention, Sanjay, as you said, keep moving.
Yeah, prevention is the key for arthritis. I mean, there are some folks who are predisposed to have an arthritis of the hip or the knee at the earlier age, and that is because some of it is inherited in the family, especially knee arthritis. Is much more common than hip arthritis because women tend to get more knee arthritis than men, and they have identified the gene to be more prevalent in the female population than in the male population. So,
women, I didn't know that.
That's right. Yeah. So, if you have knee arthritis, you're going to blame our mother for that. So that is more common in the female, whereas the hip arthritis is kind of slightly more in the men. And some people are born with that genetic predisposition, but by and large, it is essentially one can prevent it by having a very active lifestyle. As I said, motion is key for this. And also is the weight of a person. And that's very important, especially in the knee. Just to give you an example, there's a saying that a pound at the waist is 4 pounds at the knee. And the way that is the way our knee is designed, that every time, for example, if you go up and down the stairs, we are actually putting 4 times our body weight onto the knee. So if a person is 200 pounds, for example, every time he or she is going up the stairs or down the stairs, you multiply 200 times 4, you're actually putting 800 pounds of pressure onto the knee. And that's why one of the earliest symptoms or complaint of a person who has knee problem is, oh, when I go up the stairs or down the stairs, it's the worst.
When it hurts the most.
It hurts more. That's because biomechanically, or the way our knee is designed, it's just the pressure is 4 times. So, So on the other hand, if you want your knee to feel better, if you take a pound off your waist, you're actually taking 4 pounds off your knee. So keeping the weight down is the key, especially to make your knee last much longer, because that way there's less stress on the knee. If there's less stress on the knee, that 4 millimeter cartilage is going to last you much longer.
So that's another one for the audience. Besides keeping moving, as Dr. Gupta says, for every pound, how do we say?
For every pound of the waist,
every pound of the
you're
waist,
adding 4 pounds.
Putting 4 pounds
of the knee,
more pressure on your knees. So keep your weight down, folks. And Sanjay, what are what we talked about? How about jogging? I mean, is jogging tough on the knees?
It is tough, and in fact, there was we all think that if you jog, it's not good for your knees. Your knee is going to wear out for much earlier as compared to, let's say, cycling or swimming.
Yeah,
and that is true to a certain extent. But there was a recent research in England published in a British Medical Journal, where they tracked people who run marathon, at a very early age,
right.
And they followed them up, and they realized that people have been running marathon all their life. The knee was fine. But people who ran marathon and then they stopped, they developed arthritis at an earlier age as compared to people who kept running. And the reason behind is that our body gets used to the amount of trauma or the amount of stress you give to the body. So if you're running, your cartilage or your knee or your hips get used to that amount of pounding. And it becomes, it takes care of itself. But if you haven't run and now you start to run in you say mid-40s, mid-50s, then of course, if you want to be healthy and put less pressure on your hips and the knees, and you haven't been running all your life, then it's better to do anaerobic kind of exercises like cycling or swimming or elliptical, where you don't do the pounding all the time. But if you have been running all your life, there's no need to stop.
You
just continue.
Unless you put on so much weight that you can't run anymore.
That's right. Yeah.
Good, buddy. Well, we talked about prevention, and those little tips of the weight and exercise are great. Sanjay, how about, do you want to jump into some non-surgical ways of hip, knee pain?
Absolutely. So hip and knee pain.
And feel free to use any of your models that you brought along with you.
So hip and knee pain, as I said, the commonest cause, especially in adult and older life, would be arthritis. One of the commonest cause. And to prevent the arthritis is again, keep active, lose weight.
Right.
And if a person is unfortunate to develop that arthritis, the non-surgical way is to of course, painkillers is there as your last option, and one can get painkillers over the counter or see the doctor, and they can give prescription medicine.
Is there one, people that you prefer? I mean, you can mention brand name if you want, but aspirin versus Advil or Aleve, Tylenol, is there anything you recommend?
Anything works for them.
Anything works, as long as they can handle it.
As long as they can handle it, the stomach can handle it.
Right.
They're not taking for too long a period, because no matter if you take Motrin, Aleve, or aspirin, or anything like that, they can cause over a long period of time affects your kidneys or your hearts and things like that. Yeah, so anything which can the stomach or the body can handle them. And of course, they have to change their lifestyle a little bit. For example, if you have a knee arthritis, then as you talked earlier, going up the stairs or down the stairs is kind of harder, so you want to modify that a little bit. Kneeling down causes a lot of pain, so you want to prevent the kneeling, or you can put a cushion on the floor or on your knees to prevent that. If you go up the stairs, that is hard, you can put a rail so that you hold the rail and just push yourself across. And of course, just trying to avoid things which kind of hurt a lot. And usually it is the stairs and the squatting, and getting up from a seated position is usually harder when you have arthritis. And then usually one should sit in a position where they have rails on the side rails on the chair, so you can give yourself a little push on that. But the most important thing one person can do is lose weight.
Lose weight. Yeah. And Sanjay, so just in simple terms, somebody's having John Doe, Jane Doe starts to notice that they're going down. They're about 45 years old.
Right.
They're going downstairs tonight, and they're listening to us talk, and their knees hurt. They're not. What are some of the things they should look for, or they can do at home before they come and see you? And what are just some general terms?
If they just have some pain and the knee doesn't get stuck in any particular position, if they feel the knee is not kind of swollen, then in those situations, first of all, what you can do is just modify your exercises in such a way that, you know, if any exercise hurts your knee, the knee is kind of telling you that something is not right. And pain is like your friend.